Good evening. My name is Mary Trong, and I will be your host this evening. And today is July 17th, 2013. VATV is the voice of Vietnamese American throughout Boston and the greater Boston area, and it's sponsored by VietAid. You can follow our program live on every Wednesday from 7 to 8 p.m. on the BNN TV network via cable Comcast Channel 9 and RCN Channel 15, and also online at www.bnntv.org. This program will be repeated 3 times a week. So it's on Sunday at 5 p.m., Monday at 1 p.m., and Tuesday at 11 a.m. For today's program, we have the pleasure and honor to invite our special guest. So please join us in having the conversation with Mr.
Fleaszer Doza.
Fleaszer Doza.
Yeah.
Doza. Okay,
Doza,
thank you.
yeah.
He is the Executive Vice President of Synergy Rehab and PT Inc. And you can always call in, since this is a live show, at 617-708-3290. Again, 617-708-3290. So welcome,
Thank
Mr.
you.
Doza.
It's a pleasure to be here, and thank you for having me.
Oh, you're welcome. So let's talk about your, service, physical therapy.
Physical therapy, yes.
Yeah.
I can give you some general ideas what a physical therapy initially, and then we'll talk more specifically about what we do in our clinic.
Sure, but first let's begin with your background. Why did you decide?
Background,
yeah.
my background actually, I'm a trained nurse and a biochemist.
Oh.
But I've been in this business for the past 21 years.
I see.
So I do know physical therapy.
Right.
As part of my nursing training.
I see. Yes.
But I'm not working as a nurse right now. So I'm more on the business side of physical therapy.
So
now.
you make more money this way.
Not really. I wish.
Okay. Okay.
But I'm also a biochemist.
Okay.
So I have a master's in biochemistry.
Wonderful.
But like I said, I like more dealing with people, so I'm more on the people side of the business.
I see.
Marketing is my strong suit.
I see.
So that's how I've been in this business since 1992.
Oh, that's a long time.
And I've been in this business since 1992, mostly in and around the Boston area.
Oh,
We've had clinics in Jamaica Plain, Dorchester, Mattapan.
I see.
So it's all over Boston. However, I've been in and out of the business, but we started another one. This clinic that I'm involved in right now started in 2011.
Oh, I see. I see.
So it's just something that it's easy for me to get into. I enjoy doing, and we like helping people.
Oh, yeah, that's wonderful.
And why we chose the inner city, and mostly it's because it's a very underserved areas. And being a minority myself, I kind of know the psychology of people more than somebody who is not from the same background. I'm an Asian. I'm from the Philippines originally.
Oh, I see. I was wondering because your last name.
Yeah.
Okay. Yeah.
So anyway, we do physical therapy. Just to give you a little background about physical therapy, a physical therapist is any practitioner who is trained to diagnose, to treat, or to help prevent disabilities in people. Disabilities or any deficits in their function, which means that people who may have difficulty doing things that they before have been able to do. So a lot of these are brought on by illnesses, for example, or injuries, simple injuries, muscle tissue injuries. Some people have different types of problems, like genetic problems, and they could be inborn problems, but could cause disability in people. But needless to say, anyone that has disabilities or has deficits in their functioning, this is what physical therapists try to help.
I see, I see.
So it doesn't matter how you get the problem, we fix you the same way.
Oh, good. Okay. I have, maybe tendonitis in my arm, so
That's
we'll
right.
talk afterwards.
See, a lot of these, like I said, it could be brought on by a lot of medical problems
Yeah,
or orthopedic problems.
Right, right.
And we treat them the same way, just to be able to bring you back to your usual functioning, or
Right.
close to it anyway.
I see.
Because those are the kinds of people that come to our clinic.
I see.
The people who are have deficits, and so they're not able to do things that they used to be able to do easily. Now we try to help them so that they can be as close to their normal functioning as possible.
Right,
Unfortunately, for some people, if the disabilities are really extreme and massive, then we want to give him an optimum ability to perform any alterations, even change in lifestyle and stuff like that. So we try to teach them ways how to cope with their with their problems, with their disabilities, based on strengthening muscles and being able to do certain things that is learned. Everything is learned in physical therapy.
Right, right. So let's talk about training. So people who work for you.
Yeah. There are many ways now that you can be a physical therapist, but traditionally it's a 5-year baccalaureate program, meaning you have to have at least a minimum of a bachelor's degree in physical therapy. That takes 5 years.
Right.
At Northeastern, they have a program that are 5 years, some are 4 years, but the newer program that are coming out now, they call DPTs. They have Doctor in Physical Therapy, because that is what they're trying to push through right now, is that physical therapists should be able to do some diagnosing and treating without any referral from a physician.
I see.
In our state, we have what they call direct access, which is now present actually in all 50 states, including the District of Columbia, but only 18 of all the 50 states and DC has a direct access law that allows a PT with unrestricted practice, meaning that you can come to me if I were a PT, and I can treat you without any doctor's referral or prescription.
Right, right.
Some places or some states, and there are 50 less 18, there's about 32 of them. They also have direct access. You can be treated by the PT and diagnosed by the PT and treated, but it's limited. So some you can only evaluate a patient, but not treat. Some can treat a patient, but not evaluate a patient. A doctor has to evaluate them first. So there's just a variation in this direct access. There's also a movement right now within the American Physical Therapy Association to nationalize direct access.
I see.
Because right now, publicly funded patients who are receiving medical care through Medicare or Mass Health, which are publicly funded health insurance, they're not yet allowed to, the PTs cannot bill directly to Medicare or Mass Health without any authorization from a doctor.
Right. You have to be licensed to begin with, right?
Well, you do. All physical therapists have to be licensed. They have to be able to, they have to go through, complete the educational requirement, which is, like I said, 4 or 5 years, or a DPT program.
Right.
Plus, they have to take a qualifying board certification that is overseen by the Board of Allied Health.
I see.
In Massachusetts. And that's the state agency that oversees the licensing of physical therapists.
So now in Massachusetts...
So all physical therapists are licensed.
Right.
If you're not licensed, you can't practice as a physical therapist.
Yeah, right.
Yeah.
So now in Massachusetts, how many physical therapy or therapists?
I have no idea, but there was plenty of them.
I say, yeah.
In every state, actually, there is a cyclical, overabundance or shortage of healthcare providers.
Right.
PT, nurses, you name it.
Right.
But right now, there's sufficient amount of physical therapists to go around, but the problem is depending on the setting that you work in. If you want to work in a hospital, it's slightly different from what we do, which we do an outpatient, ambulatory facility. Most of our patients walk in. So there are also instances where some PTs may be working in a long-term facilities, like nursing homes,
Right.
or a subacute places where rehabilitation places like Spalding or Braintree Rehab. So there are many different settings where a PT can get employment.
That's right.
But just the same, they have to be licensed and they have to have the requisite educational background before they can even get licensed.
So how many associates do you have?
We have one full-time PT. It's a baccalaureate prepared physical therapist, and we have two PTAs. PTA stands for physical therapist assistants,
yeah.
and these are usually like an extension of a physical therapist.
Right.
They pretty much can do everything that a physical therapist can do, except that they cannot make the diagnosing themselves or cannot write a plan for a patient. So in other words, the PT has to evaluate still the patient and then writes out the plan for that, for whatever problem they have. And then he or his PTAs would be able to provide the treatment themselves. The PTAs are an associate degree prepared practitioner. So they have a 2-year college preparation.
Right.
And most of the PTAs that we have actually are college graduates. They went back to school
I see.
to become an associate degree, to have an associate degree in physical therapy.
I see.
One of our PTAs, she has a degree in psychology.
Oh, I see.
And went back and studied and got an associate degree in physical therapy assistant. And the other one, we have a Russian girl who was originally from Russia, but she has a degree in mechanical engineering.
Oh, interesting.
So I mean, we have a good group. For our facility particularly, between our PT and our PTAs, they have like a 50-year combined experience
Oh, I see.
in physical therapy, specifically in outpatient.
So how diverse?
Outpatient care.
How diverse is your clients?
Our clients are very diverse, actually. As you know, if you live in the inner city, that spells diversity.
Oh, yeah, of course. But what about Dorchester?
Dorchester, where we're located at 1558 Dorchester Avenue near Fields Corner, or actually that's Fields Corner,
Right,
but
right.
we're near Park Street, and we do have, very varied type of clientele, from Vietnamese speaking or Vietnamese, some Chinese, a lot of African American. We have Haitians, and Hispanics. And we have whites as well.
I see.
We don't have any Filipino, but that's
Right.
okay. I don't begrudge the place.
You speak Spanish?
I do.
Right.
And our staffing as well, our support staff are diverse as well. We have the Vietnamese speaking staff. We have Spanish speaking staff. I can wing a little bit of Spanish myself and Filipino.
Oh, okay.
And some Cape Verdean.
That's
So
great.
we have a good staff, knowing the makeup of
Right.
our market.
That's right.
We have made a concerted effort to make sure that we bring in the support staff as well as the staff in general, the sensitivity and the knowledge of the culture
Right.
that comprises, where we are.
That's right. That's very
It's
important.
very important, and sometimes I'd be remiss if I didn't tell you that a lot of the patients that we've had, they're so happy with the way we treat them, because for us, customer service is the key for us. In any service industry, I think customer service is the key, and not only that, you're dealing with patients. So like I said, we give them some in-service on sensitivity training, on HIPAA, which is very important, especially dealing with privacy and privacy issues,
Yeah.
which is very, very important.
Very important.
You know, we work with all the other hospitals in the area. We met actually with what's his name? I forget the name of Kearney Hospital's marketing.
Oh yeah, Bill. Bill.
Yeah, I think he
forgot
was
his
here.
last name.
He told me that he was here.
Oh yeah, he was here.
So we work and try to collaborate with them, and we use their facility, and they've extended their arms actually.
That's great.
In promoting some of the, because a lot of the patients that comes to us, although in Massachusetts we have this universal health, so to speak, a lot of people still don't have any coverage.
Well,
You'd be shocked.
I thought only 2% or less, though.
Well, you know, I mean, that's the point.
According to the governor,
2% maybe generally,
right?
But it doesn't translate 2% to people who are like concentrated in the inner city. Most of them, I mean, they can go to BMC and get free care, but they don't have any insurance.
Well,
So Carney told us that if you come across these people,
yeah.
who are in this situation, send them to us, and we'll give them a PCP. Because the problem is no one is really managing their care. Or if they have PCPs, they go to BMC. A lot of times their what they think is their PCP is a resident who took care of them while they're doing the residency. When they're done, they don't have any more doctors.
Well, yeah. No,
it's supposed to be required, but they don't.
Yeah.
I mean, and this is another area actually that people should need some good outreach in providing them with the
the information,
the information,
that they need to know,
and the ability to get into the system, and enroll for a PCP. Because it's tough sometimes.
Yeah.
And that's why, which comes to another point that I want to highlight about our facility, that although we take all insurances in Massachusetts, we take Medicare, Mass Health, and all the private health insurance, we take all of them. We also take pro bonos. So in other words, we take, we don't see patients based on their ability to pay. We see patients based on their ability to get better.
Right. Well, I hope you also refer to
we do.
just the health.
So see, because a lot of them, if and I say with their ability to get better, because that's one of the requirements of physical therapy. They have to be able to participate.
Right.
If they're not interested, you can tell them all the things that you want to tell them. It's not going to happen.
So you say you will not, regardless of the ability to pay. You cannot turn them away.
We don't turn them away.
With a broken
whatever. Actually, we currently do, at the present time, we're treating probably 3 with absolutely no insurance.
Oh, that's nice.
Absolutely no insurance.
I see.
So it's one way of doing it. And although sometimes we're still learning because of all this new stuff that's happening in the insurance industry, we're still learning as well, because it seems like rules are changing all the time. We do one thing and then all of a sudden we get a denial from the insurance company and said you didn't do this, and that's something it's news to us.
Yeah.
So now, it's not that easy.
Right.
Yeah.
How did you market your services? I mean, you place ads, do a lot of outreach?
We place ads. We do grassroots outreach.
Yeah.
Like I said, I'm entrenched in this in the community. I've been in the business for 21 years, so I know a lot of people.
Right.
So before we even open up, or after we open up, I passed probably. My name is probably all over. Dorchester already.
So how did you know VATV and Mr. Nam Pham?
The original owner of Synergy Rehab is a Vietnamese fellow.
Oh, who was it?
It's Tuan. His name is Tuan.
Oh, Tuan. Okay.
Yeah. But the current owner is he used to work for AARP. He was an executive for AARP.
I see.
You know AARP. It's a nonprofit organization.
Yeah, retired.
He used to work for, as well as he's got background amongst others. He was the one who actually developed and managed the online banking for Citizens Bank.
Wow.
So everything that you see, if you have Citizens Bank account,
Oh.
the online banking, that was his brainchild.
Wow.
So I mean, he's very involved. He's a very good, chief executive, and he's always wanted to have a physical therapy.
I see.
You know, his mother is a nurse.
I see.
And so he's always liked, to be involved in something like this.
Right, right.
And this is something that we're trying to develop so that we can, or whatever we can return to the community.
You know, I have a Vietnamese friend. He is a chiropractor, and it's a different story. But it's interesting how one of the marketing techniques that they use, actually, maybe his coworker, basically have a deal with the taxi company.
The taxi company.
If they heard of anyone who
anything
gets injured
legal,
or
as long as it's legal, I'm okay.
Drive them there. You know what I mean?
Yeah.
So
Yeah.
I mean that's
no, I mean I suppose
interesting.
it works as long as it's within the standards, because you got to remember, even now it used to be anyone can open a physical therapy clinic.
I see. Yeah.
This was back before 1984. I mean, I'm sorry, 2004. It used to be, if you have money, you can set up your own corporation, you can hire your own PT, you can hire your own support people, and you have a physical therapy clinic without any, any board that's overseeing your operation.
I see.
It's not now. Okay, now you have to be licensed by the board now. Before, a clinic itself is not licensed, but the PT is. See the difference?
I see, yeah.
But now, before you can even see your first patient, you have to be licensed by the board. The clinic itself has to be licensed by the board. You have to be, all the owners of the company, have to be vetted to make sure that they're fit, that they are not felons or anything like that, because you're dealing with patients here.
I see.
So it's different now. So now you have the board of Allied Health who are issuing licenses now, and plus now you have to have a compliance officer. You have to employ. It could be your PT.
I see.
Who is you have to appoint a compliance officer to ensure that the standards of practice are being done.
I see.
Based-
So you're being audited as well.
It is. I mean, this is a continuous thing. Okay, if you do not satisfy all these standards that are incorporated on an initial what they call a compliance plan that you have to submit with the board.
Right.
I mean, they can pull your license just like anything else.
Oh, I see. I see.
Before, that's the funny thing, because before you open up a nail salon and you need to get a license.
Right.
But the therapy
that
clinic
changed.
before, they didn't have to.
Right.
That's the amazing thing, which is good actually, because now there's someone who's like making sure that the public safety is protected.
Right. Right.
And that's, I think that is the impetus that brought up or brought about this thing. So our PT is also our compliance officer. So I mean, he can question anybody. If he also supervises all the other support staff.
I see.
But he ensures as a compliance officer because he answers to the board, in other words.
I see. Annually, right? You have to report annually once?
Yes, yeah, exactly. Or the board can come on an unannounced visit.
I see.
So they have certain requisite requirements. This, you have to display certain things, and you have to have that. You have to have a plan. You have to have a manual. All these are required. So, like I said, you can't run a business now under the radar.
Right. Oh yeah, of course.
Everything has to be, really open.
Right. And the government wants to tax you
Much
too.
like Obama
So you
does.
have
No,
to-
I'm just kidding.
We don't want to go
I
there.
know.
But so, how is your service different from
Our
your
service is different, it's like I
competitor?
said, only because we have a multilingual
Right,
staff
yeah.
that are really are entrenched in the community as well. They know not only the language, but the
Right.
culture of the people that we serve. The other thing is we take all the insurances with no exception.
Right.
and we provide pro bono services
I
as
know,
well.
I haven't heard of that one.
Our facility, I already said, you know, our staff have a combined experience of 50 years in the business in this type of setting,
Yes.
outpatient, because it's a different animal. Outpatient is different from working at Mass General or any other hospital, because those people, you know, they require different things.
Right, oh yes.
You know, ambulatory people require different things. Long-term people require different things. Although you're still employing the same training and skills you have, you know, it just adds a little bit more of added
So,
training
yeah.
or sensitivity.
So who's your biggest client besides the individual? Is it, you know, like a hospital referring?
No,
to
actually,
you, or-
like I said, because we are reaching out to the community.
Right.
Mostly it goes through word of mouth. Right now, it's mostly through word of mouth, and hopefully we'll get a few from this one if they want to come to the best one in Boston. We'll
Well,
be
you have to
happy-
give me a free
we'll
one
be
then.
happy- We'll be happy to
We'll
give you
introduce-
guys a tour. Because
Yeah,
we
that's nice.
really do feel that, you know, our facilities stand out. For one thing, it's always clean.
Good.
It's always clean. We are very, very stickler in terms of infection control standards,
right,
because
right.
that's a big thing,
Yeah.
right? So we all train on this. Plus, we are also helping to educate newer medical professionals. We have medical assistants who are doing their internship
I see.
through our facility from 3 different schools in Boston.
I see.
So you know, not only do we do that, you know, we try to do more. Like I said, we try to help train the practitioners of the future, so to speak.
Right. So now you also offer massages too, right? Because I saw
part
some
of the
physical therapy.
let me discuss let me talk to you about what physical therapy physical therapists do now.
Right.
A lot of the physical therapy treatment that we provide are you know, broken down in different steps. You know, in the acute phases, when the patient's disability or injuries are new or fresh, dictates what type of treatment we do.
I see.
We can do hot pack, cold pack. We have electrical stimulation. We have ultrasound, and of course a lot of varied techniques that only the PTs and the PTAs can perform on a patient.
Yeah.
And this requires as well special training. You know, these are called skilled PT. A lot of insurances have problems when people just come in and you just throw in a hot pack, which is, they don't consider that skilled, because you can do that at home.
Right, that's right.
Everything that we do is like a set of protocol toward which, you know, the ultimate goal is for ameliorating the pain, you know, getting the pain down so that they can be involved in more activity, and as they get involved in more activity, they progress even more. So this is like a step ladder for us, you know, a step ladder. But you cannot do something to a patient that is like 1 day old, what you're doing to a patient who's already 4 weeks old
I see.
in the program.
I see.
So it has to be graded depending on their ability and their capacity to participate. But mostly physical therapy is geared towards, like I said, functional training. Or again, the underlying cause, we care about that. But that's the doctor's province. You know, so a lot of these people are sent by doctors and they have a problem, but the reason that they need physical therapy is they had a stroke and now they have a weak arm.
Right.
So our job is to make sure that that arm is strong enough to be able for the patient to function. See, that's the difference between the medical diagnosis and our diagnosis.
That's right, yeah.
Our diagnosis is mostly functional diagnosis. And so our treatment is geared towards the function of a person rather than treating the cause.
I see.
We leave the doctor to do that. You know, so that's the big difference. And we use that through a combination of different protocols. Obviously, the protocol that we choose depends on the problem that they have. If they only have a simple soft tissue injury, where you woke up in one morning and you got a stiff neck, that's easy.
Yeah.
And it probably wouldn't take us long to treat.
I see.
But if you have somebody who had, a knee or both knees or a hip or both hips replaced, that takes longer to rehab.
Sure.
Because now they're going to have to not only will you have to strengthen everything, they also have to relearn certain things that they haven't been able to do because of their disability. So it's all retraining program.
I see.
But we won't have enough time if I talk about all the specific and
No.
every single treatment.
Sure.
But the fact of the matter is, everybody's treatment is individualized.
Sure.
It's all tailored, again, based on their condition, on the type of disability resulting from that condition,
Yeah.
and the type of disability or what that disability causes to the patient, resulting from the disability because of that condition.
Right.
And it changes based on their age, based on their size. Some people who are, for example, obese, it's more challenging than a person who is like really, who has a good base or who is fit to begin with.
I see.
So and that's why, although the national average for PT treatment is 20 to 22 days, you can see between like maybe just 8, or you can see somebody who's still with us after a year actually.
Wow. I see.
And only because after she's done with her rehab, her doctor ordered her to like lose weight and get into some health program. So we developed a health program for this individual patient.
That's
so we
great.
do all of that.
Right.
And in terms of workers' comp, which oftentimes we also get those type of patients who get hurt at work or anything related to work. Those two, they have different needs because we train them specifically in the type of work that they do. And we call that the work hardening program. So if they are like people who are like stacking boxes, that's how we do it. We make them stack boxes in the office.
I see.
Just to mimic
Right.
whatever they're doing.
So if I were a patient,
Yeah.
explain the procedure or the steps
Well,
that
you're,
I have to go through.
If you're a patient, let's say, like I said, with or without insurance, you can call for an appointment. We also take walk-in care, walk-in patients.
Okay. Yeah.
We are open Monday through Friday, with the exception of Monday, where we're closed at 4 p.m. We're open from 9:30 to 7 p.m. So you get a lot of time to walk into our clinic.
I see.
But you can walk in with a prescription or without a prescription.
I see.
We still see them because, again, this is direct access, state.
Right.
A PT can see any patient without any prior medical referral. However, for purposes of payment to us, so that we wouldn't get denied,
Right.
people with Medicare or Mass Health, they have to get, medical, authorization
I see.
and referral,
I see.
as well as depending on the contractual, arrangement with any of these various health insurance carriers that we have. You might need a PCP referral or a prior referral, but it doesn't stop you, or it won't stop us from seeing a patient before we get those. Sometimes we can initiate the treatment and then work on getting the referral.
I see.
So we can still see you. So you don't have to wait. But like I said, for ease and and flexibility, we do that. But if you want to go and call your doctor first to get a referral, which most of these patients, when they come in, they have a referral anyway, because they only come to us when they have a reason to.
Yeah, right. Well, you have self-payers too, though.
We do have self-payers, but
Right.
very rarely.
Oh.
Yeah,
I
I think since we opened the one in Dorchester, we've only had 2 instances where somebody paid out of their pocket. They paid cash.
So how do you determine how much an hour?
It's the same thing. It's the same thing. We bill one rate only. This is how it works. Okay, we bill with one rate based on what we feel is a fair rate, and we send that to the insurance. And based on our contractual arrangement with them, they only pay us whatever they want, whatever is in our contract.
I see.
So, but for insurance companies, for example, auto insurance companies, we don't have any prior contracts with any one of these because I guess by law, most patients they can go anywhere they want.
Right.
So we bill whatever we bill them, and they pay whatever we bill them. But if we bill the same amount, which we do, we send out the same bill, exactly the same thing that we sent to Liberty Mutual, to Neighborhood Health Plan or Blue Cross Blue Shield.
Right.
But only Blue Cross Blue Shield are obligated to pay what is contractually, agreed rate. So it's a different rate for different insurances.
So in terms of reimbursement, length of time that you have to wait for, say, Medicare, how long would it take you?
Medicare, it's supposed to be 30 days.
I see.
But it's never like it's never a flawless operation and even Blue Cross Blue Shield. Everything is different. Sometimes if you miss to cross the T, you're done. You know, we're going to have to submit some appeals. There's an appeals process, obviously, which is a good thing, but obviously that holds our cash flow, to a halt. Which is difficult.
Oh yeah,
it's the most difficult part
of course. This is why cash base is the best.
Of running a business.
Yeah.
But anyway, you get seen. We schedule you, or if the PT is there at the moment and he's able to see you, he would evaluate you, and he writes up a treatment plan for you.
I see.
And then part of the treatment plan is what type of protocol you're going to get. Like I said, we break it down to certain protocols. Like any other doctor, they have you have a protocol for cancer treatment, you have a protocol for hip replacement. It's the same thing with us. We follow a certain protocol, again, based on diagnosis, based on the age of the patient, based on their capacity to participate. So there's a lot of things that you do, so that even though we have a protocol, we still try to individualize a treatment protocol for each particular patient.
So
on the average, how many clients we have now?
Do you have?
I think at any given time, we probably have about 60 or 70.
Oh, that many.
Who are coming on the first month. They usually come 3 times a week. And then after the first month, they come in twice a week, And they are usually reevaluated every 30 days or 4 weeks, whichever comes first, based on, that's a standard of practice. So you have to you can face potential denial if you didn't follow that. Let's say you evaluated a patient in 6 weeks instead of the 4 weeks or 30 days. I mean, some people are nice enough, or some insurances are nice enough to pay it, but they have every right to deny you because you deviated from the standards.
Right.
It's hard to deviate from standards unless you can show, with good reason that there's no other way to have avoided that.
So we have about two more minutes left.
That's
so
it?
I know. Thanks to your information. I mean, the time goes by very quickly.
Yeah.
So any last word to our audience about your services?
Well, I think that, like I said, physical therapy now has a very expanded role in health promotion, in injury prevention, and so if they want to try to see what physical therapy can do, and particularly for synergy rehab, give us a try. I think that they would see that we are a different breed.
Okay, great.
Different breed in our facility.
Sure. Yes. Thank you very much, and I will spread the words for you as well.
Thanks again. I appreciate you having me here.
Yeah, you're welcome. And we hope that you enjoy tonight's conversation with Mr. Doza, and You can always see this program again, like I said, on the 3 days that I went over. But you can always email us at vatv@vid8.org, or you can get into our website, which is www.vid8.org. And you can call us if you have any question or any comments at 617-822-3717. Have a good evening, and thank you for watching our show tonight, and we'll see you next week. Thank you.
Thanks again.
Yeah, you're welcome.
Appreciate it.